My name is Nicole and I'm doing my informative career speech. This is to inform my audience about schooling, job duties, and job outlook on being a pharmacist. So right now I'm at Iowa Western and I'm doing my pre-pharmacy degree, which is the prerequisites that are required before you transfer onto pharmacy school, which is a 4-year degree. Some schools you can do it within 3, but the ones that I'd like to get into, it's a 4-year program. I'd either like to get into UNMC or Creighton University, just to stay around here. This is where my family is. So, what first made me want to kind of get into pharmacy is when I was younger, my grandparents owned a drugstore here in Council Bluffs, and my grandpa was the pharmacist. So ever since, I kind of seen how financially stable they were and the nice things that they had, that's kind of what made me want to do that for my family and the reason for my career choice. To get into the pharmacy program, like I said, you have to do your prerequisites, which is about 90 semester hours. And then once you get into the pharmacy program, you'll have 153 semester credit hours to complete. Usually do those within the first 3 years. You also have 7.5 semester hours that include 10 hours of professional electives, and then 40 semester hours doing the advanced pharmacy practice experience. And then you'll also need to complete the PCAT, which is the pharmacy college admissions test. You're not accepted based on your score, but the higher your score, the more likely you will be accepted. So, now that the schooling part is done, I'm going to tell you a little bit about what the job duties are of a pharmacist. A pharmacist fills prescriptions, verifies instructions from physicians on proper amounts of medications to patients. They check whether the prescription will interact negatively with other drugs that the patient is on, and about the condition that the patient has. They instruct patients on how and when to take prescribed medicine. They advise patients on potential side effects and experiences they may, or effects they may experience while taking the medication. They have to complete insurance forms and work with insurance companies to be sure that patients get the medications that they need. Some drugs may not be covered, so they would have to call the insurance company, fill out a couple forms to get that medication approved, and then go from there. They have to oversee the pharmacy technicians that work in the pharmacy, also the interns that work with them. They keep records and do other administrative tasks. The work environment. Most pharmacists work in pharmacies and drugstores, sort of like CVS, Walgreens. Some work in grocery stores like Baker's, Hy-Vee. Others work in hospital. About 23% work in hospital, 8% grocery stores, 6% in department stores, 5% in other general merchandise stores. So the higher amount is mostly retail pharmacy, which is like Walgreens and CVS, those places. Most pharmacists are known, their attire is known for their white jacket. You can usually, when you go to a pharmacy, you will know who the pharmacist is because they will be wearing that white jacket. From talking to some of the pharmacists that I work with at Walgreens, they just said that some of the cons of being a pharmacist are the long hours, and then you kind of get restless with your job, just kind of doing the same thing. And pros would be the good salaries and the wide variety of career options. To be a pharmacist, you need to be analytical, detailed, focused, and must have good communication skills. You must also have problem-solving abilities. The outlook for employment is expected to increase by about 25% from 2010 to 2020, which is fairly high compared to other occupations. So that would mean that the job outlook is pretty stable and good to become a pharmacist. And pay, the median wage of a pharmacist was $111,570 in May of 2010. Most pharmacists work full-time, and although about 21% worked part-time in 2010, pharmacies are open all hours, so some pharmacists must work overnights and long hours. So in conclusion, you heard about what it's like, what you need to do, schooling, the job outlook, and the job duties of a pharmacist, and this is what I chose for my career. Thank you.